Welcome back to Open Line. We are talking the Affordable Care Act with Get Covered Tennessee representatives. This is the time to call our last big segment. We have Monique on the line. If you have a question, call in now. Numbers on the screen, 615-737-PLUS. Monique, thank you for being patient. What's your question tonight?
I have insurance, but to know, and I've been wondering since it started, the penalties that people are assessed, what is that money going to? What are they using the penalty money for? And they say that the penalties can keep going up and up and up. How far are they going? I mean, is there a limit at some point in time?
Mm-hmm. Good question.
That's all I want to know.
Okay, I'm going to listen to your TV now. I'm going to cut this line.
Good questions, Monique. And I do want to, as far as the penalties going up and up and up, they have, in a sense, leveled off. So last year it was $695. This year it's still $695. It will be adjusted up based on cost of living, but that's it. You're not going to see any more big jumps like we had where it went from $95 to $325 to $695. Now it's pretty much leveled off. But all this financial assistance that we've been talking about through the marketplace, the tax credits, the cost sharing reductions, the penalties go towards that kind of pool of money. They're not the only thing that goes towards the financial assistance through the marketplace, but I believe that's part of it.
Okay.
For the penalties that
That's a
are
great
assessed.
question.
That was a good question.
That is really good.
Way to go, Monique. Way to
I don't think we had that question before. Where'd that money go?
Yeah, that's really good.
Sharon, could you mention again, when people are just tuning in, where they can go, physically go to find help?
Sure. So we're all over the libraries. This is what I love. And we're at Madison Library on Tuesdays.
I think from noon to 7:30.
Noon to
p.m.
7:30.
Wow, long time.
Okay. On Mondays, I'm at the Financial Aid Office at Meharry General Hospital on Albion Street from 10 to 2. On Tuesdays, the Wednesdays, I'm at Southeast Library, which is your Antioch area, from 10 to 2. We have Bellevue Library, Green Hills, Hermitage on Monday nights from 5:30 to 8. Bordeaux, which is off Clarksville Highway, on Thursdays from 2 to 7. And don't think that just because you can't meet one of those, you can still call the 844-644-5443 number and get an appointment that may not fit one of those libraries, but you can get an appointment and we will come see you or meet you, at your convenience, because it's all about getting you connected. We're going to work around you if we have to. We work almost six days a week.
Wow.
During open enrollment, trying to provide evening hours, morning hours, Saturday hours, Sunday hours. We're trying to make certain that we're accessible for the person to find us and get the assistance that they need.
Okay. Courtney, if we could pop up those numbers that we have on the screen. I told you to get that pen and paper ready. The Health Assist number, 615-313-9972. What will this number get you to?
The Health Assist, 313-9972, that will get you to the specialist that maybe if you're in the gap.
Okay.
And you need some assistance with maybe trying to find some safety net clinics or help with paying for prescriptions or something like that.
Okay, the next number, the connector, 844-644-5443. This is the number you're just talking about.
Right.
Getting that appointment.
Getting that in-person assistance with a navigator.
Okay. And you could just also do it over the phone. That's the number to call, right?
That's the number to call.
Okay. And they can maybe walk you through the website?
Yeah. Then we can't do an application for you over the phone, but you need to be with us.
Okay.
Yeah.
Okay.
Unless we call three-way with healthcare.gov.
If they call the 844 number, they can get connected with a navigator. The folks who answer do a quick screening to see what the person might be eligible for.
Okay.
And then if they're eligible for a navigator, to meet with a navigator, then they're scheduled with a navigator. And then at that point, the navigator will call them within 24 hours just to confirm the appointment, talk with them over the phone. And some folks, we've talked about how the website's improved. It's a little more streamlined now. So some folks can do the application on their own, but they need help talking through the plans.
Yeah.
Sure.
So we can, talk with them remotely over the phone through the plan options. Maybe they're looking at their computer screen, we're looking at our computer screen, and then they're able to complete it on their own, but they just need a little assistance. So whether you think you need to walk through the whole process with somebody or you just have a couple questions.
Do you find that people sometimes are a little embarrassed to ask the questions that need to be asked?
They shouldn't be.
No,
But I think
I haven't had any bashful people.
Yeah,
That's one way to put it, Sharon.
But I did want to say too, I gave all those Davidson County locations.
Yes.
We're in Clarksville, Smyrna, Rutherford County, Sumner County, Wilson County. So don't just think you have to be in Davidson County to reach out to us.
Yeah, because we cover a big market here on TV.
And that's why I thought about that. I was like,
yes,
well,
I'm
I don't
glad
want
you said
anybody to
that.
think that
Sure.
it's just Davidson County.
Yeah, all
No.
over the state.
Yeah.
People can get
all
help
over
because
the
this
state.
is about getting covered
That's
Tennessee.
right. That's right.
Yes,
That's right.
absolutely.
Yeah.
What are the things that are helpful to have in hand, whether you're having that appointment, you're making the phone call, what's going to get you started?
So basically, we're gonna have to create an account for you. So have an email address.
Okay.
That's really good to have that. And then all of your financial information as far as your income, your household sizes, the names of everybody in the household and their date of births, and the social security numbers, and any kind of immigration documentation that has numbers on it that identifies you as a person that's here permanent resident or legally here.
Now, I know this is a rare breed, but I know there are some people who watch and say, I don't have a computer, and I sure heck don't have an email address. What do you do then?
Well, we'll create an email address for you.
Okay.
When you sit down with us, and you don't need a computer because we'll bring our own.
Okay.
So,
So you can do it that way.
Oh yeah,
So no
that's,
fear.
that's
No.
perfectly fine. There's no excuses.
no excuses. We'll meet you at the Starbucks, at the apartment complex. We're just wanting to get you
Yeah.
insured
Absolutely.
and help you get there.
How quickly will you know once you make that application whether you are covered or not?
At the press of a button, when we
Really?
submit that application, I don't think 3 seconds goes by before you know what you're eligible for.
Really? And so does it come back and
Immediately.
say, yes, you're covered, or we still need
Well,
these
it
documents?
just says what
or-
you're eligible for. It
Okay.
gives you your eligibility. It's called an eligibility notice, and it'll take you through each person in the household who applied for insurance and says this is what you're eligible for based on the income that you gave us, and it's either TennCare or you're eligible for marketplace plans, and we're going to give you this amount of subsidy to pay for that, and we
And
walk
then
through
you
from
go
there.
back and pick the plan that works best for you.
Right.
Gotcha. And so then you have to kind of go back and start all your studying, right? And you all can help a little bit explain the pros and cons of things of
Yeah,
that.
because the website is designed to where you can compare plans. So you click compare, and it'll put them side by side, so you can actually like look at them and compare premiums and out-of-pocket cost and deductibles side by side. It's really a nice website.
And you were telling me you can kind of have the choice of, yes, I go to the doctor a lot, or no, maybe 2 or 3 visits a
Right.
year,
Yeah,
or
you
I
know,
have a
kinda
lot of
look to see.
prescriptions, or I don't, and it'll really walk you through.
And those are things that are discussed between you and your navigator or your assistance provider, so that we can just sit down and make it personal for you. It's not just a blanket thing. We can actually say, this is my doctor, this is my prescription, this is how much I go. You know, that's what makes it good to sit down with an in-person assistant.
Fantastic. On that note, we're going to take another quick break. We will wrap things up when we come back. Don't go anywhere.